Sperm only comprises about 5 to 10% of your semen. And, just as you were kind of talking about, the semen is mainly a vehicle, creating that environment that's going to allow it to survive through the vaginal canal. This is the Man Up Podcast, a doctor's guide to men's health. Each week on our podcast, we interview the top specialists of the field on various topics in men's health. You have questions that you are too afraid to ask, we have the answers. This week, our episode is titled, What You Need to Know About Semen. I'm Dr. Kevin Jr. I'm joined as always with my co-host, Dr. Justin Dubin. Justin, I hope you just watched the Steelers barely eke out that win over the Titans.
Hey, they're 4-2, man. 4-2.
No. We're 5-3 actually.
5-3. Wow. Holy shit.
Winning record.
One game behind the Ravens.
Yep.
That's
but
unbelievable.
We're a pretty shitty 5-3 team. I'm going to tell you
bad.
that.
You're probably the worst 5-3.
One of the worst 5-3 teams.
That was
ever.
like, what were you when you were 11-0? You were probably the worst undefeated team ever.
That's true. It's been many years. The Steelers have been shitty good.
Hey man, I can't hate though. My Giants are just an embarrassment, so I can't even watch the games.
It's I thought for a minute when Tyrod Taylor was in for a little bit, right? Or he is a QB. He was doing okay.
No, he broke his ribs, I think, so he's out. We have Tommy DeVito, touchdown Tommy DeVito,
oh, yeah.
a local New Jersey legend. So good for him. I like touchdown Tommy. Clearly, they don't think he could pass, though, so it's very sad.
Well, hey, there's always next year.
Yeah, but listen, we're officially in No Shave November. We're both.
Man, it already looks like you're already growing something already. It's been like one day.
I have a 5 o'clock shadow, man. I grow this stuff in fast, and I don't know. I'm getting good feedback. People tell me they like the clean shaven. I don't really like it.
Oh, dude, listeners, you need to send an email or DM us and let us know if you think Justin looks better bare. I just find it so awkward talking to you to a bare face.
Yeah, I don't know. You look pretty much the same.
I look the exact same. Nothing's happened. Nothing's changed.
Like when you grow the Fu Manchu, though. I like the Fu Manchu, so please grow that out. No, I don't know. I feel kind of good about it right now, but I just like the mustache, so I'm excited. But, I think we're going to be talking today about everything semen, which is one of the most common topics I think that we get asked. Walking down the street, people ask about their semen. Seriously, that's our friends ask us about us. People in the office, anywhere, they're asking about our semen. Guys are obsessed with their semen. Their partners are obsessed with their semen. We talk a lot about everything semen today.
Absolutely. I don't know. Well, I don't really get that question much walking down the street, Justin, but but yes, no, I get where you're coming from. Definitely get it asked often. There's things that you think about semen that you probably wonder a lot about in your head, but you just don't know the answers to, such as we touched on topics such as why is it the color that it is? What specifically in it makes, causes it to taste certain ways. This episode is fascinating, and I definitely promise you it answers a lot of questions you probably had when you were around your 15, 16-year-olds,
What do you mean 15 or 16 year old? I'm talking to 45-year-old guys who are asking me these questions, 60-year-old guys who are asking me these questions.
Very true.
And another part that we highlight here also, we talk about semen, but we also talk about sperm and breaking down a semen analysis. And that's something that, can be very, very overwhelming. I think we give you kind of like a very good layman's guide to a semen analysis.
Yeah, semen analysis is like a technical report when you take a look at it. It's got so many numbers on there. And towards the end of this episode, you'll be able to really, I think take away from it that if you go see a doc or you get your own semen analysis report, you're really going to be able to interpret it and get an idea of where you stand on a male fertility potential aspect.
Yeah, and I think that as long as you kind of can grasp some of the general ideas, I have seen it, and I'm sure Kevin has seen it. people come in, they have their results, they're overwhelmed, and then they just feel like they're completely infertile, even though most of the time they're not. And just having some general knowledge, I think, will really put you at ease. Now, obviously, these are generalities. Each individual case, there's a lot of different situations. It takes two to tango. But I think listening to our conversation on semen analysis and semen will give you really a good background just for fun facts, walking around, or just trying to learn about your health and really improve yourself and your fertility.
Absolutely. This is a great episode. And before we jump into it, I just want to thank all our listeners for sending in some questions for us through IG.
Yes.
We had a ton of really good questions. So on our next intro, or one of our next episodes, we'll kind of touch base on some of those questions, and it's going to really instigate some really good discussion between me and Justin. So thank you again for those questions.
Yes, it was awesome, man. And as always, feel free to reach out. We're starting to get more emails since we told you our actual email address. So feel free to email us as well. Email us and questions, comments, concerns. You can always follow us, subscribe, download Spotify, iTunes, YouTube. We have the cameras. We're editing it now. This is, I think, one of our first episodes, full episodes that we do with the actual new camera workup. So it should look pretty damn good.
So watch
enjoy
it.
So watch it. Watch our beautiful faces. I'm not clean shaven in it yet. So,
but in the intro, you are.
Yes, correct. So now you can compare. If you watch, you can compare directly.
And then vote at the end of the episode. Do you prefer Justin
on the YouTube? Comment on the YouTube.
Yeah, love it.
Roast me. I don't care. That's fine. Just comment. All right, man. I think we're good. Let's rock and roll. First episode for Men's Health. We got some fun content coming out. So enjoy the episode and take care of yourselves. As men's health specialists, we know guys are shaving their balls. Yeah, we examine a lot of you, so we literally see it, but we also have the data showing it too.
That's right. According to research, over 85% of men trim their pubes. Not only that, but research shows that over 70% of women prefer a partner with at least partially trimmed pubic hair.
So guys, we know you're trimming the hedges, and we know that most women prefer you manscape. So if you're going to shave your balls, why not use the best men's grooming kit around? We're talking about Manscaped.
With the Manscaped Performance Package 4.0, you get the Lawnmower 4.0 with their all-new skin-safe electric trimmer that protects your balls from getting those cuts we've all had in the past. You also get the Weed Whacker 2.0 for trimming your nose and ear hairs. And let me tell you guys, we all need to do a better job of this.
Yep, that's right. Kevin and I both have the performance package, and we really love it. Manscaping has never been easier for us. And for our listeners, we have a special promotion. Go to manscaped.com and enter promo code MANUP and get 20% off your first purchase.
Go get your Manscaped products today. Your balls and your partner will thank you. So, Justin, my man, today we are going to talk about everything related to sperm to semen, because this is an area that we specialize in and we know quite a lot about. So we feel our listeners should kind of get some information from us on all things that they wanted to know about sperm.
Yeah, I think this is a very popular topic. A lot of guys come in just asking general questions about semen. It comes up often when we're talking about other sexual problems. So yeah, I think we should just get into it because we're pretty much going to answer some pretty common questions, general understanding of semen and what's in it and stuff like that. But let's really start off with that question. What is in semen? And I think a lot of people are surprised. When we're talking about semen in general, you have to understand what the purpose is, right? The purpose of semen is to create an environment to protect sperm so that, that sperm can get into the vagina, get into the uterus, and then achieve a pregnancy. So, creation of that environment is what the majority of semen is. Now, Kev, what percentage of semen does sperm actually take up?
So sperm actually, surprisingly, everyone thinks that whole, everything that's coming out is just, 100% sperm. But actually, sperm only comprises about 5 to 10% of your semen. And, just as you were kind of talking about, the semen is just like mainly a vehicle that's carrying the sperm on for a ride to try to get to its destination. The objective of sperm is to fertilize, right? That's the objective. And
Correct.
we're basically just creating that environment that's going to allow it to survive, with it, through the vaginal canal, up into the cervix. So that is the main thing. But so, Justin, what else is comprising or contributing to the rest of your semen volume then?
So the majority of your semen volume is actually from the seminal vesicles, composing about 60 to 70% of the volume of your semen. Excuse me.
Mm.
And, it includes things like fructose, amino acids, phosphorus, potassium, and citric acid. And, these things really help create that favorable environment for sperm. And, there's other things that get involved as well. The prostate also gets involved, which creates PSA, which we've talked about in previous episodes, actually helps really liquefy the semen. And then, finally, there's these things called Cowper's glands, which actually secrete some fluid and help liquefy and lubricate semen. And that's kind of the combination of what everything is. And when we're talking about semen in general, we also have to understand that there's a certain pH that will be important for other things that we're talking about here in the composition. But in general, semen is alkaline. Now, Kevin, why is semen alkaline?
Well, before we jump into that, I want to back up a sec, just so that way we don't kind of bypass this this important point that I feel like I answered the question for a lot, because on the previous episodes we talk about PSA screening, right? And I'm just going to go back on that because this question it's asked all the time. Everyone's like, what is the point of PSA? Why do I have PSA? And I tell every guy, look, if you have a prostate, one, sure, you're going to be generating PSAs. And as a result, we use that to screen for prostate cancer, right? We use that to screen for prostate cancer. But what it's actually doing, and this is what I think is kind of fascinating, is PSAs are used to help liquefy it, right? There's a point to it. It's not just like some random number out there that's just kind of exists. The
magic of the human body. Everything has a purpose, believe it or not, except for, I guess, the appendix. But otherwise, everything else has a purpose. So you're right. It is very, very cool to know that there is a purpose. PSA does something, liquefies the semen, and helps you achieve a pregnancy, and also helps us screen for your cancer. But now going back to that question, what were you gonna say?
But is there another function for PSA besides that?
I do not know. Do you?
I'm trying. I thought there was. That's what I'm trying to think off. No, maybe there isn't. I'm just making things up right now. It's late night recording, but
yeah. But no. So let's go back to the alkaline question.
Okay.
Why is semen alkaline?
So that way it can help kind of survive in the vaginal canal. I think that's what you're trying to get at, right?
Yes, that's what I'm trying to get at. And that's how I always remember it, right? Because the vaginal environment is acidic, and then the sperm has to be alkaline, the yin to the yang. I always find it so fascinating there. It's amazing how science works.
Yeah.
That they cancel each other out to provide a safe passage for sperm.
And that gets back to this the idea we're talking about, right? This shit, this semen that's going through. The main objective is to just protect sperm as it gets its way up again to its final destination. Again, what it's supposed to do, which is to fertilize an egg. Now,
I just wanted to say, and then the other thing that when we're talking about composition, that's important that we talk about a lot with vasectomies is that, guys are like, am I going to just shoot out dust? And the answer is no. No, I mean, people are like, am I going to just dry orgasm? I'm going to shoot out dust. What's going to come out after a vasectomy? We just told you 5 to 10% of your semen is sperm. The rest is coming from other places. So your volume is going to be the same. pretty much. So it's nothing to worry about. You're going to be able to orgasm, you're going to be ejaculating, and it's going to be pretty much the same before or after a vasectomy.
Yeah, I think Dr. Patel on a previous episode talked to us about it, and I kind of use the same thing when I kind of incorporate it into some of my counseling, where a lot of patients that Justin and I see do have some pathology where they're actually not having any sperm in the ejaculate. That medical
Mm-hmm.
term is azospermia, but like they never knew because their volume seemed normal.
Great
They were
point.
just like, this is a normal semen volume, and nothing seemed abnormal. And in those patients, unfortunately, they actually have no sperm. But that, goes to show Justin's point that you're really not going to notice much of a difference post vasectomy just because of how small amount that sperm's actually comprising of your semen. But Justin, let's talk about volume though. Some guys do come in, it's an inevitable question that we get where we're like, the guy comes in, he's like, my semen volume just seems like it's decreasing. So, is something happening? Is this something to be worried about?
In general, maybe. Right? I mean, the answer
Yes.
is maybe.
Yes.
Because, let's just talk about in general the volume, and we'll go into semen analysis later in the episode. But, in my head, I think the guidelines, the World Health Organization says 1.2 to 1.5 is
Right.
around it. I always say like 1 cc, 1 ml. Less than that is considered in my brain low volume. Now, there's a lot of different things that can be assessed, and especially with volume, when we're talking about a semen analysis, they're often lower because no one likes coming in a cup. It's not comfortable. You miss something.
That's not fun
You got
for
to
you,
milk
Justin?
out everything. You're not fully aroused, right?
That's not fun for you?
Oh,
Just
I mean, I've done it. You've done it. I
I've
mean,
done it,
full
yeah.
disclosure, we've all done it, but it's fine. It's fine. But you're never going to get that max volume.
That's
You're
true.
just
That's
not.
true. That's true.
So, that's one thing. That's the semen analysis side. But, people, like you said, do come in and they say, hey, my semen volume has decreased. What's going on? And to that, I say, okay, let's figure this out. There's a lot of different things that could be going on, right? One could be, did you start any new medications? And that's usually one of the most common ones that we deal with. And what's that medication, Kev?
Well, for some of our patients who are suffering from enlarged prostate, having some lower urinary tract symptoms, one of those medications, and all you guys, we're all going to hear about it at some point, and that is called Flomax, or tamsulosin is its generic name, or any sort of alpha-1 blocker. So this could be alfuzosin, but by their brand names that you've probably heard of, it's mainly Flomax. That's the main one you
Right.
heard. And that medication really relaxes the bladder neck. That's how you get improvement in your urination symptoms. But as a result of that relaxation, you're actually going to kind of lose some of that kind of push forward to kind of get the semen out, and some of that kind of goes back up into the bladder. Now, Justin, a lot of guys always ask me, is that really bad for me if the semen hangs out in my bladder? What's the answer to that?
Absolutely not. I mean, I always tell people, if you're not trying to have a kid, you have no mess, man. It is no mess. You're orgasming. It's fine. Don't worry about it. But people, especially in South Florida, people really love the money shot. I got to tell you. And a lot of people find it very distressing. But if you have that problem, and it's something we can address that, right? I mean, there's other medications we can give you for prostate problems. So that's one possible thing. That's called retrograde ejaculation,
right.
by the way, is the technical term. But retrograde ejaculation can come from other things too. And one of the bigger and more common things is actually diabetes.
That's right.
Now, I see that a lot in young guys who have poorly controlled diabetes. Diabetes is one of those things we think about. Our hands, our eyes, our feet are the first things to go. But guess what? The nerves in your penis, the nerves in your pelvis, they're much smaller. And often, your erections go. And that could also include your ability to, contract strong enough that you ejaculate forward. And unfortunately, I've had to do, you might need to do a surgery, you might need to do different things to get sperm out of these guys. Most of the time, not. But there are situations where, that could be a warning sign that your diabetes is very poorly controlled.
That's a fantastic point. Just the whole diabetes and potential cause of retrograde ejaculation, or just failure of emission, just because you're just like, diabetes, I stress this to guys who, especially guys who are like kind of overweight and they're like, no, 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 I'm fine. I'm like, diabetes can cause so much shit to your body, so much
Absolutely.
shit. And like, for you to like not even be able to have a antegrade or forward ejaculation, these are things that can happen. Just in highlights, yeah, you commonly think that, oh, like, thinks my legs are gonna like I'm gonna lose sensation there, or like, things may happen to your kidney, but no, this happens in for patients who are trying to conceive, and then they find out like, oh, my uncontrolled diabetes has actually caused me to have an inability to, ejaculate. So it's a big
Yeah,
issue.
it is. And obviously other things. Obesity is a big factor that can play a role here. Increasing age, those muscles to contract, if they're just not working through whatever means, including aging body and being out of shape, it could actually play a role. And then, the other most common thing is getting pelvic surgery of any kind.
Mm,
Often we see it from prostate cancer, getting a prostatectomy. Those guys usually have no ejaculate because we cut the vas deferens, we
mm,
cut the seminal vesicles. So they actually don't orgasm. They have dry orgasm. They're not infertile. They just can't get the sperm out of their bodies or out of their testicles specifically. But it can happen with other pelvic surgeries too. I mean, if anything damages the nerves, similar to diabetes, you can have these problems. So there's a lot more things that you would think of can compromise a decreased volume that are potentially pathological, that could be warning signs of other problems going on. But there's also, a direct result of something bad happening. And sometimes you just, age getting old sucks, man.
yeah, it's those are some of the harder ones I know when I'm talking with some of my patients where, we kind of go through everything and you can't really, it's like, I've gone through every single one. I'm like, no, I don't think any of these kind of like, are, causing your issue. And the last point you touched on, sometimes with age, and age is kind of, testosterone is somewhat a little bit related to some sort of.
Yeah, I agree with that. Another thing that we've talked about all this decreased volume, but then the question, a lot of guys come in and they're just interested in increasing their volume in general. So, what are some ways in which guys can actually increase their semen volume, Kevin?
So one of the main things that I check for is hormones, right?
Right.
Especially testosterone. Testosterone is very important. So one of the chief things, kind of workup plans, is to get some blood levels of your testosterone level, and if it's kind of low, that could be one of the things that's kind of causing your lower semen volume, and then by kind of bumping up your testosterone up a little bit, we can kind of get better volume. So that's one. Making sure you're having good erections and all that stuff,
Yeah.
it helps too. So, if you're having a little bit of ED, maybe getting you on some, oral PD5 inhibitors like Cialis or something like that will kind of help with that too. Justin, what other strategies you have?
I think like hydration is important, and
Mm,
we'll go into that as well. Being hydrated, taking care of yourself, stuff like that. The amount, and we're going to go into consistency and stuff like that. But I think the amount of and frequency of sexual activity plays a huge role in your
yes.
volume. You should never expect, if you hadn't orgasmed in like 5 days, you orgasm, and then an hour later you have sex again and you orgasm. The volume's not going to be there, right? It's just not, like, that's just not how your body works. So you also have to be realistic with these things, and to some degree, you just can't. To some degree, I think your volume's your volume. And other things we give patients for retrograde ejaculation, you give patients Sudafed, which can help tighten, how the Flomax has, as Kevin said, can relax your prostate, relax your bladder neck. The Sudafed actually does the opposite, which it causes constriction and tightens your prostate and tightens your bladder so that you can actually have forward ejaculation. And that's often one way that we help try to treat, or at least try to help our patients with retrograde ejaculation who, don't have obviously a medication that's causing it or anything. So I think that's another thing. Sudafed would be helpful in this case.
Yeah, you're absolutely right. And then I want to kind of stress to patients though, Sudafed doesn't always 100% work. Let's say if you
Oh
are dealing
no.
with retrograde ejaculation, it's kind of one of our things like, all right, we're going to give it to you, kind of hope that this works, but the numbers aren't always the greatest on using Sudafed. It's almost like probably like a flip of a coin, I think, probably.
I don't know the data on it.
Yeah.
I would say that you're right there. I would say for, almost 50% of the time, patients say it helps. And then I've had guys who say it helps and
Yeah.
then it doesn't help them the next
Yeah.
time. And I
Exactly.
think a lot of it is timing, how
Yeah.
much they're taking,
Right.
how aroused they are. And
Yeah.
that's another factor, right? How aroused are you during this time? Are you rushing through sex? Are you just masturbating quickly? You're not letting yourself, you know, build up. I think that there's a huge factor there too. But
Yeah.
so I think that's kind of volume. Now, another very, very common question that we get asked about is semen color. You know, I don't even just get this asked by patients. Friends of mine, dudes, I'm walking down the street, they're asking me about why their semen changes colors, what the deal is with that. So Kevin, can you just enlighten us a little bit of like what color should my semen be?
Well, for all our listeners, just so you know, off the air, Justin and I talk to each other a lot about why our own semen colors changes quite often. I'm just kidding. But no, but look, so semen, the normal typical appearance or color of semen is usually like a cream gray, opalescent, or kind of like an off-white. Now,
Yeah.
sometimes what we do see and what you may see is that semen becomes a little bit more, mildly yellow. All right. And this is normal with age or some prolonged, abstinence from ejaculation. And this is really because the yellowing is carrying a lot of dead epithelial cells. So this is like essentially think of like kind of dead skin that's on the inside that's
Mhm.
shed in the secretions of the seminal vesicles. Now, Justin, this is what are normal or kind of typical findings of semen color. Why would you see some transparency or opacity of semen? What are these things dependent on?
I think this is like one of those things where a lot of sexual health, which is really cool, as you've listened to our episodes, it really depends on lifestyle too.
Mm,
So
yeah.
so your ejaculate clarity and all that stuff can actually be impacted by things you're doing. Your diet, how you're eating, your medications, abstinence, how frequently you're ejaculating,
Hmm.
like you said, infection, potentially, hydration status. So, because we see guys, some guys go, oh, one day it's like pearly white thick, and then the next day it's clear like water. And I'm like, well, how many times did you ejaculate between? Were you drinking a lot the day that a water the day it was watery? There's a lot of factors, but I mean, just like most things in medicine, there's a huge spectrum. There's
Mm,
a huge spectrum of what normal is. And I think identifying first, not what normal is probably what abnormal is probably the more important thing. So like, what what colors are we freaking out about? What not freaking out about necessarily? What colors should we consider if you're a guy coming to talk to us? Come talk to our doctors, Kev.
well, how about this? I'll touch on the one that we also see a lot of. One of the things is,
Yes.
you
Yeah.
know, and I mean, we're urologists, so we're much more aware of it. But if I wasn't a urologist, I would probably freak out. And that's
Oh, absolutely.
seeing some redness or rust color in your sperm, right? And immediately you see that, you're like, whoa, do I have blood in my semen? Again, Justin and I are urologists, so we are less freaked out, but I definitely understand from our listeners or from our patients why that could be, kind of terrifying,
Alarm. Yeah.
alarming. Yeah. And then, especially if it kind of persists. So, first off, what I, want to say is hematospermia, which is the medical terminology for that. So, blood in the semen, for the predominant, like 99% of the time, this is like something benign. All right.
Right.
Just happens to be there. It's not like I differentiate it from when a patient comes in, it's like I've peed actual blood and I can't tell you if there's anything, you know, any reason why. That I'm a little bit more worried about. That, I will work up. We'll do further testing. But for the most part, these isolated episodes of blood in the semen, I'm not too concerned about. It's pretty benign.
No, I
Um,
agree 100%. I agree 100%. Most of the time, patient comes in and I say, hey, this is going to be okay. Or they even say, hey, it happened twice, it resolved, it haven't happened in a month, but I freaked the fuck out, so I just wanted to come talk to you. And I say it's probably not going to happen again. Now people go, what the hell caused it? And sometimes we just don't know, right?
Yep. Mm-hmm.
Maybe you had some kind of trauma during sex, maybe you popped a vessel inside
Yeah.
your tract somewhere. Maybe who knows, we had just rough sex or something. Most of the time it's nothing. Some stuff we do check. You can check for infection, STDs. In a persistent guy, I have done it a couple times, who've like over continuously for months had blood in their urine. We always check a PSA for
Mm-hmm.
prostate cancer. That's the one thing we do check, or you should get checked. And also I do a cystoscopy if I really need to, or an MRI of your prostate. Very rare, but if it is something persistent. But I think Kevin in general is very correct. This is nothing to worry about, but we do recommend talking to someone about
Yeah.
it and seeing someone for that problem. But what other colors are concerning, Kevin?
Well, I wouldn't say concerning, but look, like, if certain medications you take will cause potential changes to your semen color, right?
Okay.
Right. So I wouldn't say it's concerning, but I'm just, listeners should know that, hey, like, if you took, what is this? If some supplements, supplements are guys that they like take a lot. These can cause changes in consistencies, differences to your semen, but they're not really any cause for concern. Um, I guess if it gets a little bit more yellowish or orange, these could be potential signs and causes of an STI. You know, um, so the way I tell my patients, honestly, really, at the end of the day, most things you shouldn't really be too concerned about. That's from my perspective.
Yeah, I mean the other thing is like brown or black semen. You should not be
Well,
having
that you
brown
should
or
not see.
black
Yeah.
semen. That you should not see. You should go see someone right away, because you probably might have some kind of infection. You might have some kind of, it could be old blood, but we do want to just get that concern. So, in general, concluding the semen color spectrum here, most of it varies, and it's okay to be variable in your semen consistency, in the clarity, the liquid. But a couple things to keep your eye for when it comes to weird colors. Obviously, pain with ejaculation, dripping from your penis. Those are other signs of potential infection, prostatitis, UTIs, STDs. So yeah. Now, we talked a little bit. We didn't really talk about smell. And this is something that truthfully, I very rarely, once in a while, I'll see a patient who notices that their semen smells a little bit different. And most of the time I feel like it's nothing, but what can smell indicate? And what does it usually smell like, Kev?
So, as you stated earlier on the episode, so semen is alkaline, right?
Right.
So it's going to smell something similar in that range of pH. Sometimes it's cited that normal smell is kind of like a bleach, a little ammonia, a little chlorine. But
Absolutely, we've all smelled our semen. Come on, let's be honest. That's exactly what it smells like. A little bleachy, chlorine kind of smell.
Yeah. Now, look, the semen is something that our body produces, right? And a lot of it's produced from the seminal vesicles. You touched on it, has like fructose and all that stuff. So things that you're eating, I guess this kind of goes along with everything we're saying about consistency or about, color stuff.
Right.
Things that we eat could potentially have an effect on the smell. All right. Now, one of the common things that you're going to probably see a lot of on social media or stuff is talk about asparagus, because asparagus for sure absolutely has an impact on the smell of your urine, right?
100%. It smells terrible.
It smells terrible. So, gonna do the same thing to your semen too, and that can have an impact on how it smells. Other foods like garlic, dairy, people say that can have an effect. The only thing is that if it's having some sort of persistent foul smell, this could be, again, going in line with what Justin was saying, a sign of a UTI, STD. But usually you're having some other sort of symptoms. So those other symptoms are a little bit more prevalent than just a abnormal change in smell of your semen. But I mean, that's basically it, Justin, unless you have something else to add.
No, I think that's pretty much it. Like, it's the smell is the smell. A couple of things you can potentially do to compromise that smell, including diet, but I don't think the data is very good in that front.
Right.
But leading to foods that can compromise your semen, one of the most popular topics that we see on social media is, can food impact the taste of your semen? And, that's like in every movie, in every show, especially you see, some girl who's like loading up on pineapple.
Oh, yeah.
Getting ready, or no, the guy's loading up on pineapple. I'm sorry. She's telling him to load up on pineapple. And so, there's this old thing that, especially things like pineapple can make your sperm sweeter. Now, is it true? I would say maybe. Why? Because, we do know that pineapple is very rich in a high sugar. It has a lot of high sugar content, right? So, eating it in theory can increase, the fructose in your body, increase the fructose in your semen. And in addition, in general, because of that alkaline smell, that alkaline taste also comes with that alkaline pH of your semen, which is often a bitter taste. Now, I've not tasted semen, but that's what it's been said to taste like, a bit bitter, and that's because of that alkaline acidity or alkalinity of the semen. So it's thought that the pineapple's high fructose can kind of neutralize a little bit of that bitterness with the fructose and make it sweeter. Now, can it actually work? There's no real data. I think it's all theory, but Kev, what are some other fruits that people think can maybe make your semen taste a little bit better? Now, guys, I'm sure guys are listening to this now. They're writing them down. The girls are writing this down.
Yeah, so get that pen and paper out,
Yeah.
Other fruits like kiwi, peaches, dates, blueberries, cinnamon. I think wheatgrass has been mentioned before.
And that doesn't even sound sweet, though. But yeah, I know. I agree with you.
But let's just get to it. All this stuff, you can go on the internet and you're going to find probably all these recommendations, probably some recipes that you could probably try to help improve it. There is no definitive data on it. Now, there's also supplements out there that state that. Again, possible, yes. Any definitive data on it? No. Just like Justin said, this is all kind of like very, hypothetical. We're postulating here. Yeah, this is going to bump up your fructose level. So, yeah, theoretically, and maybe there's anecdotal evidence, but who knows if it's just placebo because you told someone like, "Hey, look, yeah, I just ate a ton of pineapple."
Just no contact, no talking, just eating pineapple for dessert. Every dessert is pineapple. You're on your honeymoon, you're just eating pineapple and peaches. I mean, I love pineapple. I mean,
it's a fantastic fruit. Fantastic fruit.
It's not a top 5 for me, but it's a good fruit.
I wouldn't say I eat it often. It's kind
I don't either.
I wonder why.
It's just not enough. I mean, someone has to cut it for you, right? Like,
well, you can cut it for yourself.
I buy my own pineapple.
You can cut it for yourself.
It's an annoying fruit to cut. It's a really annoying fruit to cut.
I agree. I completely agree.
It's not convenient. So, and then it's kind of expensive to get the pre-cut.
Yeah,
so,
absolutely.
I have the Trader Joe's frozen pineapple in my freezer, though. Those are actually very good.
I'm going to go on a tangent here. Those pre-cut fucking fruits, so smart. And so, because I hate cutting up fruit, but then they upcharge the shit out of it, right?
Oh my God. It's like 3 times the price.
Yeah. Fantastic business model. Yeah.
I never bought. No, I cut my own fruit, except I guess sometimes pineapple, and I just don't eat it because I don't want to spend the money. It's 3 times as much. But yeah, it's a great business. You just literally charge.
You just cut it up and then you upcharge it 3 times.
People love convenience, man. Convenience is key here. But all right, so listen, I think that's a good summary of a lot of the semen questions. That's a general composition of the semen stuff. We do want to kind of quickly delve into something that a lot of people really want to know about,
Mm,
the semen analysis, right?
yeah.
So those were the general things about semen. We're going to kind of really now look into the sperm within your semen and break that down, because at the end of the day, the semen analysis is the gold standard, for us in assessing fertility. And it can be very, very overwhelming when you get these numbers, whether it's from an online company, whether it's from a lab. You're like, what the hell am I looking at? Is this normal? Is this abnormal? And hopefully, through this part of our podcast, you'll really kind of get a better gestalt of what's important, what's not important, what to worry about. Does this mean I'm never going to be able to have a kid again? So, Kev, you want to start it off for us?
Yeah, you know what I thought would be cool is both me and you kind of just give what our spiel is whenever we go over.
Okay.
All right.
Okay, I like that. I
All right.
like that a lot.
Because there is no, at the end of the day, everyone's going to have their own little kind of nuance in the way they approach it, because this is not
Right.
an exact science.
Correct.
As I'll kind of state that. So, the spiel I give my patients when they come with a semen analysis, you're going to get this huge, huge form that's going to have all these medical terminologies, percentages everywhere. And, a lot of times you'll see like abnormal, normal, abnormal, and you're just going to be like, what the fuck does this all mean? And how do I interpret it? So for me, how I simplify it for patients, I go first, look, most important thing about semen analysis, these are average numbers, like fifth percentiles and above, that are obtained from the World Health Organization. They took a look at a bunch of population sets of people that were able to conceive within a year and then use these numbers. So there are patients with numbers below that, albeit very small amounts, that still conceive normally. All right. But it's a small amount, but it's usually a sign that maybe there could be issues going on. So for my patients, I go like, look, I look at volume, I look at your total motility, I look at your sperm concentration, and then I kind of put that all together and I make this total motile sperm count. That's the way I kind of counsel my patients. So my volume, and I know Justin, you talked about use one. Mine, I use about a 1.5 for mine, right? Anything above
Okay.
1.5. And then in terms of the motility, I do the usually around 40%. And then,
But what is motility?
so motility is just any movement of sperm. Okay. Now there's a difference. They break it down further where you
It's
have
very important. You said any movement. Yes, correct.
any movement, right? Because there are, if you continue to kind of break it down, there is progressive motility where you're actually kind of moving forward, and then kind of the non-progressive where you just kind of stand still, but you are motile. The tail of the sperm is still kind of moving. But again, when I do that kind of quick hit, I really just focus on the total motility, unless there's something I need to kind of break down. And so that's at 40%. And then in terms of sperm concentration, which is basically taking a look at breaking out how much sperm you have per cc or per milliliter. Usually I go about 15 million per cc is kind of my kind of cutoff that I use. And then, we put all these numbers together and you'll get this grand total number of total motile sperm count. And, that's how you can kind of, segue into some certain things if you have pathologies. But Justin, how do you kind of counsel your patients on a semen
I
analysis?
usually am very similar, and we'll talk about the thing that we both left out at the end.
Yeah.
But what I like to say is, listen, this is a spectrum, and I think another thing that you have to understand, like Kevin said, is that your sperm on one day, we've talked about variety and things, how semen can change from one day to another, that there is variability. Your sample one day doesn't mean you're always going to be that day, and the sample next time you do it doesn't mean you're locked into that semen analysis. There's so many lifestyle factors, there's sexual frequency factors, there's factors we don't even know or understand that are impacting your daily semen parameters. So you have to understand that there's variability here. And often I like to get at least two if I can.
Yes.
I usually start with one because we're within reason. These things are not necessarily cheap, and insurance usually may not cover it. So, I get one. If I'm concerned, then I go for a second one. And it doesn't mean that you're in trouble because one's low, but
Yep.
you can kind of get a better window of where you're at. So that's kind of how I started. I say,
Fantastic point.
this may not be your true value, whatever we're looking at. Okay. Unless you have 4 with me, then I probably feel a little bit more convinced. But in general, 1 doesn't mean that's necessarily where you are. So that's to start. And when I look at it, I explain it. I care about 3 things. I care, 1, about volume, semen volume, because something has to come out if you're going to have a baby naturally, right? So something has to come out of your penis. 2, I care about the concentration, because there has to be sperm, right? And I think one thing that you have to understand is it is in millions per cc. And when you look at that number, so saying 5, it's not 5 sperm, it's 5 million sperm per milliliter. And most guys are ejaculating more than 1 milliliter. So that's another thing to look at. And then 3 is you need motility, because your boy's got to swim, because you could have a billion sperm, but if they can't swim, they're never going to get to the egg. And that's exactly how I explain it. And it's very simple to understand, because, you can have sperm, can't swim, not getting anywhere. And then I do the total mole sperm count. And just to kind of explain a little bit further what the total mole sperm count it is the volume times the percentage of the motility times the concentration. And that final number is in millions. And once again, we're talking about millions with an M. So every time you ejaculate, theoretically, that is the amount of sperm in millions that gets to the egg for insemination. And that's how I kind of break it down, because that's the important number at the end of the day. Why? Because if your number is normal, great. You can get to the egg, you're good. If your number is a little bit low, maybe you need help. Maybe we need a little help getting you there with the IUI. Or if your numbers are pretty much non-existent or there's very scant, then you really need help. And maybe we just need to do IVF. But like Kevin said, I'm not a math guy. And this is what I tell people. Even if it's low, I say, listen, 3 million is considered low, severely low. Severe oligospermia is what we call it. And I say, I'm not a math guy, but I know there's 1 egg, maybe 2 eggs if you're lucky, and you still got 3 million sperm every time you ejaculate. So is it impossible? No. Is it low likelihood? Sure. So that's kind of how I think about it, because we'll never, people live their whole lives and they could be subfertile their whole lives and they have 3 kids and you just never know. And then people get, what I mean?
The exact point. That's the exact point I tell my patients. Like, dude, the semen, a lot of times when you're here in the office, probably things have been going on. So I always kind of take that into context. Unless you're coming in there like, hey, I just want to check myself out, fertility, sure. But a lot of times you're like, yeah, been trying here and there. I take that into context. But Justin makes a fantastic point. There are people that are out there that probably have like 2-3 million, but they're just have kids, and we just don't have any record of that. And so, that's what makes fertility kind of tricky at the end of the day. And we try to do our best to try to put some kind of, boxes around it to try to help kind of, help us drive our treatment, but it can be tricky.
Now, what are some of the cutoffs though? Obviously 15 million, and you gave us the general cutoffs. When we're talking about IUI, IVF, what are the cutoffs that you like to use, or the IVF centers? Because at the end of the day, the truth is we don't make the cutoffs. It's really the IVF centers and you as the patient, based off of, your finances, your goals, what you're willing to do, what you're not willing to do, and the sperm count. Obviously, these are all factors that we have to do as a shared decision maker. But, we're here to optimize your sperm and give you the realistic samples. But, at the end of the day, you're going to be going to your IVF doctor if you decide to go the artificial insemination route or artificial reproductive technology route. I apologize. So, Kevin, what are some of the cutoffs that they're looking for over there?
So one of the important numbers when I talk with my patients is if you're trying to get to IUI, which is, again, intrauterine insemination, which is basically, you take your semen, it gets spun down into the sperm, and it actually just gets placed into the uterus. Nothing's done in a petri dish. Nothing's done outside the body. It's just taking that sperm and kind of taking it closer to the finish line by putting it in the uterus. That number is 10 million. All right, 10 million is that number. But there are situations, and I think, Justin, you published on this early on in your burgeoning career. But you did a fantastic paper on, because one of the surgeries that Justin and I do a lot of are these varicocele repairs, because varicoceles, which are swelling in the veins. I guess we'll do an episode on that stuff
Yeah,
at
yeah.
some point, but that can cause lower sperm concentration. And Justin kind of showed that, like, you know, doing these varicocele repairs can kind of get you above. I think that number you had
If
at
you
that
have
point,
one, obviously.
if you have
If
one,
you
right?
have them.
If you have one, was to 5 million, right, Justin? I think that's where you showed
Yeah,
that.
so the cutoff. So some doctors can use 5 million, and we're talking about the cutoff is total motile sperm count.
Right.
That's the number that we use. Um, but yeah, it could be 5 million, but in general, yeah, it's 10. 10 is the number, because you're spending money. You're putting your partners going through this process. You really want to make sure you're optimizing it for the best, right? And that's
Right.
kind of the plan. But when you're deciding between IVF and IUI and all these things, there's other factors, right? Maybe you can't afford IVF. Maybe there's other factors at play here, because IUI is significantly cheaper. The success rates are not as high as IVF most of the time, but it's but yeah, 10 is the cutoff that we're usually looking for. Now, my question for you is one thing that is all over the semen analyses, which I get a referral all the time for, and I'm
Oh,
sure you get a
all the
referral
time.
too, is morphology. And morphology is one of these things that has plagued a lot of people and has caused a lot of unnecessary stress. So tell us about morphology. Tell us what the thought process is and what's really changed in the last few years of its role in fertility.
Well, here, how about this? I will talk about morphology, but I still refer a lot to your recent commentary that you kind of put out on it. So here, let me talk about morphology. So
Okay.
morphology is, okay. How is a sperm supposed to look like? Right? Sperm has
Right.
its head and its tail. All right. Now, if I was to tell, like, Justin and I, we look under the scope a lot. If you would take a look at it and you looked at sperm, you don't get 100% perfect looking sperm. No, for the
Right.
most part, majority of it actually look kind of like crap. Like, they're not the perfect shape, which is, again, like a nice head with a tail that, and there's, like, specific things that an andrologist is supposed to utilize to characterize it as normal, or there's something called, like, Kruger grading, or, I'm not going to really get into that. But morphology, basically, that magic number that they state that you should see within a semen sample should be about 4%. Think about that. 4% of all the sperm that you're analyzing is considered normal. The rest can look like crap. So for me, I mean, I'll let Justin get into it. For me, like, the things that I get more concerned about is if every single one had, like, the same defect, and you see it all, and it's kind of, you know, amongst all of them, they're all monophasic, whatever. Everything's the same defect. Yeah, that's a little bit more concerning to me. But if you come in with, like, a 3% morphology, I'm like, yeah, you know, not to say anything to andrologists or embryologists who are already looking at it, but probably if you looked a little bit more, you'd probably get to 4% too.
That's a good
Um,
point.
but
Good point.
uh, but Justin, why don't you kind of shed some light on that commentary that you gave?
Yeah, so there was a paper that came out a while back, and I was fortunate to review it and give a commentary on it, and an opinion piece, basically saying morphology is completely worthless. I think it's completely useless. There's literally one situation in which it has value, which you alluded to. But even in the 0% morphology, saying all your sperm are abnormal, it doesn't really matter unless you have like one thing called like globospermia.
Right.
And you can tell that by, in the comments of the semen analysis, it says what kind of, usually it says the kind of defects, right? Is it two tails? Is it abnormal head? But it would clearly say globospermia. And globospermia in itself is normal sperm, actually. It can absolutely be used for fertility, which is further to the point, but it has to be used through IVF because its head is defective, so it can't penetrate the egg.
Right.
But in general, we know that abnormal sperm does not impact the ability of the sperm to fertilize the egg. It does not cause, birth defects. It does not have any outcomes in the future of the child. at all. The other thing that and this is the real issue we have with morphology, is the studies that we've seen. We took, like, I didn't do it, but there's been studies where they take the best labs, the best andrology labs in the country, sometimes in the world, and they ask them not only give us they took the same sample and they said, this morphology, what is the morphology of this sample? And no one consistently was the same. Then they asked them, they said, don't even give us the same. Just say, is it 0% or is it all is there not 0%? None of them could do it. They couldn't do it consistently. So the problem is, you can't have a tool that is used as a guide if there is no consistency in the people that can read it, right? So the value is inherently zero. And that's my inherent problem with it, because if you don't have a consistent instrument, you don't have a way to measure anything, right? And you can tell easily if you have globospermia by looking under the microscope. But other than that, I think there's nothing to worry about morphology. I don't think there's really anything you can do. I'm not aware of anything you can do to change your morphology, unless, Kevin, you want to comment on that. But I think for the most part, don't worry about it. Very rarely, less than 1% of people. I've never seen globospermia. I don't know if you've ever seen it, but it's very, very uncommon. And the chances are, if you even have 0% morphology, you're going to be fine.
Yeah, no, that's fantastic point. And that's kind of the same things that I kind of tell my patients when they come in with that, and they're so honed in. They're like 2% morphology, 3% morphology. That said, I will say that I do think with artificial intelligence, and just from what I've kind of like done my research on, being able to kind of scan through, they're going to kind of be able to remove some of that subjectivity and maybe kind of incorporate some objectivity. So will morphology maybe play a role down the line where you could kind of tie in that, like, hey, look, there's a lot of these like abnormal ones, but you can tag the normal ones, use that one. I don't know. Maybe. But again, and something I always end when I talk with my patients about anything related to sperm, we're still learning. We're still learning a ton about this. Like, our conception rates when it's coming to like assisted reproductive technologies is nowhere close to 100%. So we still have a large bridge to kind of figure out, a lot on the male side, and just trying to how to optimize and stuff like that. But yeah, no, exactly.
Yeah. No, and we'll talk about it. We'll do like an IVF specific episode, IUI episode. But obviously we talked about it a little bit with Dr. Crawford for sure. But there's other aspects where people say, is it the egg? Is it the sperm? And that's a whole other conversation to have for another day. But sometimes, like you said, we don't know. I saw a patient last week. I said, there's one way to test it out, and it's donor sperm versus your sperm, and we see if something works and if it doesn't work. And some people don't like that idea, and that's okay, but sometimes it's just very, very difficult because we don't have the technology. I guess the one final question or topic that may come up is DNA fragmentation, which is on the newer end of stuff. Now, you want to briefly describe what DNA fragmentation is?
Yeah, sure. Briefly. So DNA fragmentation is basically taking a look at, just to kind of really simplify it, to see if there are any other effects that are acting on the actual sperm DNA itself. And the thought process is, if you have an increased amount of the sperm DNA damage, even if the sperm is great and it gets in and it gets into the egg itself, there's a preponderance of it not to kind of carry on, and it just has kind of like a self-detonate kind of thing, because it's just like, oh no, the DNA is just not going to good, crash and burn kind of thing. And so that's the idea of it. And you can do tests to determine the amount of DNA fragmentation that you have within a sperm. And but a lot of times I have had patients come and ask me for it straight off the bat, normal fertility work. You're like, hey, I read about this.
Interesting.
And I'm like, wow, you are very educated, one, and very well informed. But it's still not considered like normal workup, right, Justin?
Correct. No, not even close to the standard of care. Our guidelines really don't recommend using it unless you've had like 2 miscarriages or something like that.
Right.
Why? Because A, it's expensive. B, There's not a lot of resources still out there to get it in the most common places. You usually have to go to a tertiary center or something like that to get it. And then see, sometimes, we don't know how to interpret it, or we don't know what
Yes.
to do with it, right? Because there's different ways you can consider treating it,
Yes.
but sometimes you just say, I don't really know. There's things called like a Zymot chip that the
Hmm.
IVF centers can use to kind of just have the sperm race to the other end, and whichever ones are healthiest have the best DNA fragmentation. If you have a varicocele, like Kevin mentioned before, maybe we could do a varicocelectomy
Hmm.
theoretically. But I've had guys, I just tell them to ejaculate more, and
Yeah.
it's actually worked.
Oh yeah.
You
Oh yeah.
know, so it's something that's very new. There's a lot of different DNA fragmentation tests out there. There's not one gold standard yet, really. So it's kind of on the newer stuff. But yeah, there's indications. But I agree, Kevin. I would never just automatically sign up to get a DNA fragmentation. I don't think there's really value in it. And often I'm going to say, I don't really. Have you guys achieved a pregnancy yet? No. Okay. Well, I don't know, because it's just like sperm, right? Like that guy that you said has maybe lived at 3 million, has 3 kids. This guy could have had. There's a million people out there who had like the worst DNA fragmented
90% DNA
sperm.
frag.
Yeah, and they have like 10 kids, and you never know. So it's a very niche thing. It's just like all of this. There's variability. It's an individualized case. And that's why, the semen analysis can get very confusing. It can get very overwhelming. And that's why it's important, if you do one, go talk to your doctor about it. Go talk to your local urologist, and they can kind of help break it down, just like we did today for you guys.
Yeah, I'm a big believer in that. Like, hey, it's okay to like kind of like, hey, I'm interested in my male fertility potential. Let's get a semen analysis. I'm all for that. But there's no need to really dig in deep, right? I'll offer my thoughts on other stuff a little later. Justin and I always talk about this, but I do to a degree believe in like some sort of biohacking. But fertility, we just don't know a lot about it, right? We just don't know still a lot about it. And so, if for the most part your semen analysis is good, right? There's nothing much in it. You haven't, if you haven't even tried conceiving yet, then you really just kind of leave it at that. You're just like, okay, good. I got men in the waiting to go. They're getting out that they need to, and then you try. Then if there's situations where you're like, hey, I've been trying with my partner for 6 months, and we've been doing exactly the way, every other day around the time of ovulation, then yes, then we start digging into it.
Yeah, I agree. I agree with that. I think knowledge is power. And I do encourage people, if they are interested in their fertility, absolutely go for it, because it's one of those things where a lot of guys come in and they go, we were taught in school, you have sex one time without protection, you're going to immediately get pregnant.
Yeah.
Boom. And it's not the case. It's just not the case for a lot of people. I mean,
Right.
Some people get lucky, but for a lot of people, they go, what the fuck? I've been trying for a year and a half, and I still don't know what's going on.
Yeah.
So, if you are interested, there's a lot of access to these things, and there's a lot of information out there. Just, like Kevin said, don't freak out. See what's going on. Talk to your local healthcare provider. I think that's a good way to end it, man.
Good way to end it, bro.
All right. So thanks, as always, for listening to this week's episode. Questions, comments, concerns, please feel free. Our email is live now, at the man up. Well, it's not at anything. It's the manuppod@gmail.com. Correct?
That's correct.
All right. We have a link tree now. We're doing everything right. So follow us on socials at the Man Up Pod, TikTok, Instagram, Twitter, X, YouTube. We got the new cameras. I think it looks good now. Finally, it worked. So, subscribe, download everything on Spotify. Give us a review, 5 stars, iTunes, 5 stars, reviews. Thanks for listening, as always. For Kevin and Justin, see you next time.